Safer at home. A few things to know. COVID-19 has changed almost everything we do. Many people are now working, attending classes, dining, and doing most of their daily routine at home. But what about people who can't stay home? Law enforcement, firefighters, doctors, nurses, and other medical and safety professionals must go to work. These essential personnel know their profession places them at risk of contracting COVID-19, and they take proper precautions while at work. But it's also important for them to take precautions before and after work. This production from the National Center for Biomedical Research and Training was made to inform you of some safety measures for emergency responders to help you and loved ones feel safer at home. Home safety. Safety starts with a good plan. Use the practices in the presentation to have a plan on how to minimize the risk of introducing the coronavirus to your home. Plan ahead. Minimize the amount of items that you carry between home and work. Consolidate personal bags, and secure personal items away from work areas when possible. If you can, bring a change of clothes and shoes, as well as a plastic bag for dirty duty uniforms. End of shift, uniform care. If your organization provides laundry service, carefully remove your work uniform and follow departmental procedures. If your organization does not provide laundry and you have the opportunity, change into clean clothes and place the dirty uniform into a plastic bag. Wash your hands with soap for at least 20 seconds and refrain from touching your face. End of shift, vehicle care. Whether you have an official or a personally owned vehicle, use a bleach solution or 60% alcohol wipes to sanitize. Do this prior to and after driving. End of shift, arriving home. When arriving at home, establish a disinfecting station where you can wash your hands or use approved hand sanitizer prior to opening the door. Remove and wipe your shoes and store them away from living spaces. If you're still in your work uniform, change and bag your dirty laundry. Once sanitized and while avoiding family members, take the shortest route possible to the laundry room. End of shift, laundry care. Wash your dirty work laundry immediately. Do not shake dirty laundry. Doing so raises the possibility of dispersing the virus through the air. If possible, launder items using the warmest appropriate water setting, 120 degrees Fahrenheit or greater for the items. Then dry the items completely. Dirty laundry that has been in contact with an ill person can be washed with other people's items. Clean and disinfect hampers or laundry baskets according to the guidance here for hard or soft surfaces. And take a shower before having contact with family members. Safe practices at home. Routinely disinfect commonly touched surfaces while at home. This includes countertops, phones, computers, tabletops, light switches, faucets, sinks, and doorknobs. Frequently wash your hands with soap for at least 20 seconds. Refrain from touching your face. Stay at home unless it's necessary for essential duties or home needs. Do not allow guests other than household members. When possible, open windows and doors to allow a draft to circulate air. We at NCBRT thank you for your service and hope this presentation has provided useful tactics to make your home safer. Please visit our website for additional resources.